Hello, my dear friends. Hope you all are fine, beta. Hello, everyone, beta ji. Hello, 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 everyone. Everyone, how are you, beta? How are you? How are you all? How are you all? Finally, we are meeting again as promised. One day after the exam. I hope that all of you guys have done your best. And my dear friends, definitely once the results are out, many more good news are going to come on our way. Sincerely praying for each and every one of you, my dear friends, and definitely you will be coming out bright, shining like a star whenever the results are out, my dear friends. Yes, Bapre Bap, finally, we are meeting after the exam, and I hope that all of you guys will be passing the exam better. Yesterday it was a moderately difficult type of question. There is a mixed feedback from the students that somebody is saying paper one was tough, somebody is saying paper two is tough. This what happens. It all depends on how your questions have come common in your exam. So based on that, you can also feel whether it was difficult or easy. Practically for biochemistry, it has also been one more time the savior, my dear friends, and I believe all of you would have got the all the questions of biochemistry correct because all the questions of biochemistry did come from our notes beta. So yes, रोना क्यों आ रहा है? रोना नहीं आ रहा आना चाहिए. Results अब आ जाएंगे बेटा. Results will be coming definitely on time. So yes, so let us hope that all of you guys are joining. Just I will start in one more minute. Yes, almost all the questions are came have come from the workbook. Yes, Patnak. Yes, biochemistry very helpful in paper one. Shakti Singh Rathore. Yes, beta. Thank you, Nikhil. Yes. ऑप्था से क्वेश्चन कोई बात नहीं बेटा आई मीन इट ऑल डिपेंड्स ऑन ओके इट इज maybe from one subject if it has got less number of questions from the other subject definitely more number of questions would have come. Okay, so yeah, without any more waiting, let us try to move on. Yes, the students are still joining beta, I believe. Yeah, so yes, okay, चलो कोई बात नहीं बेटा and I hope definitely you would have got the required number of MCQs correct to pass the exam beta. It doesn't matter how much you are getting. If you are getting a very good marks, that is very big boon for your further preparation in your later life. But as of now, I believe each and every one of you would have definitely got the required number of MCQs correct. Now, first of all, let us try to focus on this beta and let us quickly go ahead with the MCQs. We are going to discuss about the 12th Jan 2025 MCQ recall, and I believe I am going to beginning with a question that has been little bit confusing among many students beta. There was some question like this and I believe all of you can agree with me on the history that has been provided in this question beta. एक बार इसको देख लेते हैं. Yes, in this question they had mentioned about alcoholism beta. In this question there was alcoholism was there in this question, and I believe the students had also mentioned about gum bleeding, petechial hemorrhage, corkscrew type of hair pattern, right? Corkscrew type of hair pattern. Yes, this sort of question was there, and they had also mentioned about poor wound healing. These are the words that has been used in this question beta. Try to understand this. Yes, this question was this. Yes, ऐसे questions थे बेटा. Just try to, maybe the language of the question might not be exact accurate, but the essence of the question has been yes. So here the answer in this question, everybody was anticipating that as they had mentioned about neurological system generalized weakness, people were thinking that it is a case of Goa, like Wernicke-Korsakoff syndrome, but Goa was not there. Yes, same question, vitamin C. So in this question, beta G, please try to understand the correct answer of this question will be vitamin C over here. Please remember, vitamin C, my dear friends, also has got some correlation over here. Try to understand gum bleeding, petechial hemorrhage, poor wound healing, this sort of things can be also possible over here, right बेटा जी? तो इस क्वेश्चंस को हम लोग याद कर लेंगे. यही था. थैंक यू सो मच फॉर योर फीडबैक बेटा जी. लेट अस ट्राई टू go for this. Vitamin C has been the predominant vitamin in the yesterday's exam beta, and there were 3 to 4 questions which has come from the vitamin C. I will also show you the other questions as well बेटा. हम लोग बाकी के questions के बारे में भी बात करेंगे. Try to understand this point बेटा. As of now, try to understand. Do not get confused with this generalized weakness as well as lethargy as well as some neurological symptoms, and they have been experiencing since long time. Most likely vitamin deficiency will be the vitamin C most of the time. The options also we have tried to keep it as much as intact as possible. In this question, basically it is a directly from our expected question note, that is our collagen topic beta. And in the collagen we have also discussed about a case of scurvy. There was poor wound healing, all those things, delayed wound healing. There was petechial hemorrhage, gum bleeding. So basically if this sort of histories are actually mentioned, point to be remembered, we have to go for the answer as vitamin C itself. Vitamin C itself we have to remember for this, right? Important question. Do recall about this. Vitamin C is very very important for the collagen maturation. There is one more question which has been asked, I will discuss in detail beta, that they had also asked question on this hydroxylation, prolyl and lysyl hydroxylase. Those things has also come, that we will be discussing in another question. Try to understand some important info over here. This is a page from our workbook. Try to recall, we have discussed about collagen maturation, and we did discuss about proline and lysine are actually getting converted to hydroxyproline and hydroxylysine over here, and this is done by a group of enzymes called as hydroxylases, either prolyl hydroxylase or lysyl hydroxylase, and this is where the vitamin C is playing a role. Basically it is helping in the conversion of the primary structure to the secondary structure. And in case of scurvy, as there is vitamin C deficiency, there is a problem of the pro-collagen to go for collagen synthesis, and ultimately it will go for very severely weak type of collagen synthesis over here. Now corkscrew type of hair pattern, that is also mentioned in this question beta. Okay, corkscrew hair pattern. Remember, if vitamin C is deficient, we can all understand after secondary nothing is possible, because once primary is having difficulty to go for secondary, then the tertiary and quaternary structure of the collagen also will be taking in hit. And in the tertiary to quaternary, although we require copper, and we have also discussed about something called as Menkes kinky hair syndrome in this particular topic. In this Menkes kinky hair syndrome, that is due to ATP7A gene mutation, but this is also related to collagen, and we had also talked about this kinky or curly type of hair. We have also seen this image based questions during our 25 most important session, and try to understand. So vitamin C, if it is defective, it will create problem from primary to secondary. Tertiary and quaternary also will not be possible. That's the reason, my dear friends, even in case of vitamin C deficiency also, some texture of the hair can also change over here. That is the take home point that we have to remember in this question. Yes, important point, try to remember beta. Isko dekh lenge. Yes, okay. So this is an important point, try to recall about this. Now coming to the next important question. Yes, this was actually taken again from our 25 most important session beta. In the 25 most important, I believe all of you have got this one correct. All of you would have got this one correct beta. Try to focus on this. Try to focus on this beta. Yes, this sort of question, probably this image was also given. Answer. Answer, my dear friends. Answer, my dear friends. I believe you would have got this one definitely correct. इसमें कोई दिक्कत नहीं होगा. आंसर आंसर आंसर. Yes, all of you can easily go for the answer as zinc beta. This is a case of acrodermatitis enteropathica. We had discussed this in our 25 most important session. Acrodermatitis enteropathica. Acrodermatitis enteropathica is the case over here, and we did discuss this in our 25 most important session. Please do remember, this is the right question, that all of you have got this one correct. I told you mostly there is a rashes over genitalia plus face. There is also face image was not shown. Basically genitalia image was shown, and try to remember this is the zinc deficiency acrodermatitis enteropathica, right? Coming to the third question beta. Coming to the third question, this was as a bouncer. दिस वॉज ए बाउंसर बेटा. ये बाउंसर था. ये बाउंसर था. बाउंसर. सम क्वेश्चन which was bouncer. Let us discuss about this. Diarrhea history was also mentioned. Okay, I will also mention the diarrhea history over here. Diarrhea was also positive in this question. Thank you so much for giving me this hint. Okay, coming to this bouncer question, what was the answer beta? Yes, please tell me. Important question. Diarrhea. Okay, in this question, yes. Hyaluronic acid in the option, yes. Okay, so they had asked about which is the glycosaminoglycan that will be elevated. See, in this case, the question was asked only on Nato-Wish syndrome. In Nato-Wish syndrome, basically there is a deficiency of hyaluronidase beta. This is the answer. If they would have given the compound, then you can also remember beta hyaluronic acid. In Nato-Wish syndrome, there is actually problem with the hyaluronic acid beta. It is due to the deficiency of the hyaluronidase. This Nato-Wish syndrome is actually mucopolysaccharidosis type 9. Type 9 beta, type 9. It is a bouncer question because we have discussed as far as Fmge levels were concerned only one type 1 and type 2, but question came as a bouncer beta, type 9. Yes. Keratan sulfate was, oh, so they had given the options like this. Keratan sulfate. Okay, they had given the compound's name, not the enzyme name. Thank you so much, beta. Keratan sulfate, dermatan sulfate. They had also given dermatan sulfate. Okay, like this. So the compound name, not the enzyme name, beta. Thank you so much for giving me this information that it was actually asked on the basis of this. So hyaluronic acid will be the answer in this question, not the enzyme, beta. Yes. ओके यही लिखा हुआ था टाइप 9. ओके टाइप 9 वाज मेंशनड. ओके ग्रेट, थैंक यू सो मच फॉर योर इंपॉर्टेंट हिंट बेटा. टाइप 9 लेटर वाज मेंशनड इन द क्वेश्चन. थैंक यू सो मच, थैंक यू सो मच. Type 9 dermatan sulfate was also there. Yes, so type 9. Okay, if you guys have chosen the answer as hyaluronic acid, you would have got definitely one more mark beta. Thank you so much for giving me this feedback. Thank you so much. Okay, आगे बढ़ते हैं. Question number 4. Yes, this is another question that has been also asked from the topic of vitamin C, and I want help from all of you in this question, that what was the exact option that was actually asked. Many of you are telling me that in this question option was prolyl hydroxylase, and few of them are also telling me lysyl oxidase. I just want you to remember and try to remember over here. थोड़ा सा इसको याद कर लेंगे बेटा. Try to recall that what was the exact option that has come, whether they had mentioned prolyl hydroxylase or whether they had mentioned lysyl oxidase. What was there? ओके इसमें एक बार देख लेते हैं बेटा. व्हाट इज द एक्स आई मीन इन द ऑप्शन lysyl hydroxylase. Okay, lysyl hydroxylase was there in the option. Okay, lysyl hydroxylase, lysyl hydroxylase was given. Okay, lysyl hydroxylase bhi tha. Okay, so in this question if lysyl hydroxylase was given, then this also can be chosen. So it depends on the option beta. My dear friends, what they had asked, they had asked that which of the following is actually for collagen maturation, or all of the following except. Did they mention except? Because try to understand over here in this question, prolyl hydroxylase is also dependent on vitamin C, lysyl hydroxylase is also dependent on vitamin C. What was the question? Did they ask except? Lysyl oxidase, lysyl hydroxylase, both were there. Did they ask except beta? क्या उन्होंने except पूछा था? Try to recall beta. Did they ask about except which of the following is not, or like that? No, not except. So in this case, my dear friends, if it is asked like this, that which vitamin C deficiency will try to affect, answer will go for beta lysyl hydroxylase. Lysyl hydroxylase will be the right answer, because point to be noted beta, lysyl oxidase is dependent on the copper. Prolyl hydroxylase, you are telling that it did not come as an option, it was not there in the option. So lysyl hydroxylase, yes, this will be our right answer, lysyl hydroxylase, because just now we have seen, try to remember over here, in this we have just now seen that we require two type of hydroxylase enzyme, one is for proline, another one is for lysine. They would have got lysyl hydroxylase. Point to be remembered beta, lysyl oxidase, that is participating in oxidative deamination, that is dependent on the copper. If they have mentioned the option as vitamin C dependent problem, then my dear friends, the answer will definitely go for lysyl hydroxylase. So this is the right answer of this question. Yes, great. Lysyl oxidase is dependent on the copper. Lysyl hydroxylase is dependent on the vitamin C. So this is the right answer of this question. Hope you have got this one all correct. Thank you so much for the feedback, beta. Okay, this question was there. I'm sure short. This question was there, and it has also been asked directly from our notes. Okay, answer of this question. Answer of this question, my dear friends. Answer of this question. Yes, waiting for your answer, beta. Waiting for your answer. Fifth question from Biochemistry. Yes, yes, all of you are right. All of you are right, beta. Yes, the answer of this question is decreased gluconeogenesis. Yes, please try to understand. Decreased gluconeogenesis, my dear friends, is the answer over here, and all of you got this one correct. This is taken directly from our expected question section of our link reaction. During link reaction, we have also talked about this pathway, beta. Yes, this is the direct question that has been asked in our exam, beta. Decrease gluconeogenesis, yes. Decrease, yes. Increased gluconeogenesis was also in the option. So increased gluconeogenesis, let me put it over here as one more option, beta, extra option. Increased gluconeogenesis. Thank you so much for giving the hint, but the answer will remain as decreased gluconeogenesis. This is a question that has been directly taken up from our notes, beta. I also did mention that whenever we have discussed about the link reaction topic, in that we have talked about the effect of alcohol and gluconeogenesis. ये mark किया हुआ है LQ, and please remember this will decrease gluconeogenesis because it will increase NADH plus H plus and it will try to convert pyruvate more to lactate. हम लोगों ने देखा था दारू पीने से NADH plus H plus will become high and it will try to convert the pyruvate to lactate. Pyruvate will be converted to lactate. As the direction is now towards lactate, pyruvate will not be able to get converted back to glucose. So gluconeogenesis, my dear friends, will be decreased over here. So this is a direct question that has been just picked up from our workbook and has been given in your exam, beta. इसको देख लीजिएगा. This is a very very important question that we have to remember. Inefficient था. Try to recall about this. Okay, going for this next question. Going for this next question. Sixth question that was asked from Biochem. Yes. Sixth question that was asked from Biochem. Yes, try to understand this. Essential pentosuria. Hello, again taken from our workbook. Essential pentosuria. Okay, that was inhibit gluconeogenesis, not decreased. I will remove the word beta decreased. It will be inhibiting. So we should put the word as inhibit. Yes, inhibit. Inhibit gluconeogenesis was the correct option. Okay. Coming to this question. Yes. Yes, my dear friends. Yes. Xylulose. Yes. Xylulose. There was, acha, they have asked what is the, which of the following, I mean, will be wrong option. ये पूछा था. Okay, xylulose. Okay, not the enzyme name like this, beta. Which of the following enzyme नहीं, which of the following carbohydrate or which of the following maybe sugar they would have asked. Maybe they have asked like this. Ribulose, ribose. Okay, ribulose, ribose, they are one of the option, and I believe they would have definitely given L-xylulose, right? So L-xylulose will be the answer of this question, beta. L-xylulose. L-xylulose. Okay, got it. Thank you so much for the feedback, beta. They did not ask the name of the enzyme, they had asked actually on the sugar name. Yes, ribose, ribulose, xylulose. Okay, so in this case the answer will be our xylulose, essential pentosuria, 5 carbon sugar. Try to understand. Xylulose, ribulose, ribose, all are 5 carbon, but this is a question that has been picked up from our workbook. Try to understand. We have discussed about it is a part of Garrod's tetrad. बोला था कि important है. Part of Garrod's tetrad, where we have got the fourth disorder called as essential pentosuria, and this is due to the enzyme deficiency of xylulose reductase. So the sugar that will be released over here in the patient's urine, it will be our xylulose. L-xylulose will come out in the urine. Yes. Please remember, L-xylulose was there in the option. Thank you so much for your feedback. Try to understand this. Next question. Next question over here. Try to look for this question. Yes, ये भी उठा उठा के आया है. This question also is directly picked up from the biochem workbook, beta. Which is enzyme is responsible for removal of triglycerides from the chylomicron? Direct question. Direct question, beta. Yes. Answer of this question, beta. Waiting for the answer of this question. Those of you who are listening right now, beta ji, answer of this question. Try to look over here. Yes, beta ji, answer. Answer amylase tha. Okay, okay, this, yes, the answer, my dear friends, all of you are thinking in the right line, beta. All of you are thinking in the right line. The answer is lipoprotein lipase. This is also picked up from our note, beta, that it will help in the removal of the triglycerides from the chylomicron and VLDL both. Actually, it is also able to release this from the VLDL, beta. This is a topic. Yes, this was there. Yes, everything would have been there, beta. That's why we have picked up this. Don't worry. So lipoprotein lipase, yes, this is the other options that I have cooked up. Lipoprotein lipase and amylase, these two options students were able to recall perfectly, right? So this is also a question that has been picked up directly from our workbook, beta. In this lipids chapter as well as in the carbohydrate chapter, we have heard multiple times that enzyme lipoprotein lipase, it is present at the peripheral tissue endothelial lining. This is the location of this enzyme LPL, and this is actually able to take up the TAG that is coming from either small intestine exogenous TAG or liver VLDL endogenous TAG, and the TAG part will be selectively taken up. Only thing that we have to remember, beta, is that this TAG part will be selectively taken up inside the peripheral tissue, and the gatekeeper over here is lipoprotein lipase, and this lipoprotein lipase is activated by ApoC2 and inhibited by, my dear friends, other ApoA2 and all those things that we have discussed earlier, right? Important. Lipoprotein lipase को देख लेना, activated is both C2 and C1. ApoC2 is a better answer. So this we have also discussed in our topic, beta. Yes. Okay, great. Try to remember this point, beta. आगे बढ़ते हैं. Okay, question number 8. Try to recall over here. Question number 8. Yes, few students also did discuss about that. There was a question on marker of apoptosis. Marker of apoptosis. Marker of apoptosis. This question, my dear friends, would have been there, but a marker of apoptosis. Yes, just try to look over here. Yes, 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 yes. All of you have got this one correct. All of you, my dear friends, has got this one correct. And the answer of this question is beta phosphatidylserine. Yes, phosphatidylserine. Yes, phosphatidylserine. Okay. Okay, phosphatidylserine. Okay, maybe the options that has been given in the other three might not be correct, but the essence is the intact one. That is that phosphatidylserine is the right answer for this question. It was not marker. Okay. 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 Which one flip outwards? Which one will flip outwards during apoptosis? During apoptosis. So this will be also a question of pathology, beta, because when sir would have definitely taught about this, he would have also definitely mentioned about this. Flip कौन सा था apoptosis में? Okay. Okay, marker नहीं पूछा था. It was not the marker, not the word marker, beta. It was a question that flip outwards during apoptosis. Even in that case also the answer will remain the same, that is phosphatidylserine. So you would have got all this one also correct, right? Okay, coming to this phosphatidylserine page, we have discussed phosphatidylserine is actually an important marker of apoptosis. So anyhow, this question might be overlapping and you would have got this one definitely correct, beta ji. आगे बढ़ते हैं. Let us move into this question one more time. Yes, this question was also asked. ये तो expected question topic था, आना था, आ गया. Expected question topic was this. I believe all of you would have got this one also correct without any difficulty beta. Okay, this question, try to look over here. Yes, answer is same, कोई बात नहीं, question language is different, you would have got definitely one more mark. Yes, my dear friends, all of you are right that it was actually a chocolate question over here from biochemistry. I told you expected question area alkaptonuria for this session, and the answer would have been homogentic acid oxidase. Yes, homogentic acid oxidase. All of you have got this one. Yes, chocolate question, alkaptonuria, vertebra, euchronosis, all those things they have mentioned, and this will go for alkaptonuria topic. In our alkaptonuria, we had also talked about this homogentic acid deposition over our lumbosacral spine, intervertebral cartilages, knee joint cartilages, as well as under the pram, as well as over the cornea, sclera, all those things. We had also talked about the image-based questions over here. We have also talked about this palm. In the vertebra, I did show you this image-based question, zone of calcification on the X-ray. This sort of things we have discussed, and it is a question of alkaptonuria. आगे बढ़ते हैं. Yes, there was a question of rickets. I guess all of you are waiting for this question. Please do let me know whether this is the same image that they had shown or they had shown some other type of images of ricket. रिकेट के क्वेश्चन था, एवरीबडी नोस, बट एक्चुअली क्वेश्चन कैसे आया था? Actually, what was the type of the question? Did they show this radiograph or they had showed bowing of legs? What is the image that they had used? Students told me that they had used some image in this question of rickets, classical history of rickets with some image, x-ray. x-ray पूछा था बेटा, x-ray आया था. Rupin, I will come to that question where that crush injury wala, I have that image. I will also show you that. Rupin, just wait. Bowing of legs. Okay, bowing of leg image. Okay, thank you so much. Bowing of leg image was actually given. Bowing of leg image. Bowing of leg image. Bowing of leg, lower leg, bowing of legs image. Okay, thank you so much for your great feedback, beta. Answer will definitely go for vitamin D deficiency. Yes. Varus deformity. Varus deformity was actually being shown. Wide wrist. Wide wrist. Okay, 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 okay. Okay, 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 okay. So widened wrist was mentioned in the literature, and bowing of legs was given in the image. Thank you so much. Thank you so much for your feedback, beta. Thank you so much, beta. Basically, in this case, that we can see the image clusters, all those things. This is the point that we have to remember over here, beta. Harrison sulcus, all those points we have also discussed. That pigeon like chest, all those all of you know. Also, now come to this question, beta. इस question को देखते हैं जल्दी से. I believe the history might not be the same, but there was a question on the osteogenesis imperfecta, right? Option was ricket. Okay, in this question, not like this. Okay, not like this. The option, the diagnosis in this case was rickets. This is what they had asked. Okay, rickets का diagnosis पूछा गया था. Thank you so much for your feedback, बेटा. आगे बढ़ते हैं. In this question, okay. Yes, this question. Yash, I will note this question, beta. Thank you so much. Yash, I will note this question that you had just put up in the chat section. Thank you so much for your feedback. I have missed this question and I will also include that. Thank you so much, Yash. Okay, coming to the question number 11, beta. This sort of question was there. Yes. Did they ask the collagen defect or did they ask the name of the disorder, beta? Yes. Right. Important. Okay, it was there. I don't remember. Okay, ये question. Yes, question was similar. The osteogenesis imperfecta. What is the question that they had asked? Beta, did they give you the history? Did they give you the history, beta? Sustained fracture. Okay, ये क्वेश्चन नहीं था. Then what was the question on the osteogenesis imperfecta? Students told me that they had asked a question on osteogenesis imperfecta. What was the question? Okay, ये नहीं था. But what was the question that they had asked in the osteogenesis imperfecta? What is the question, beta? Try to recall. Try to recall. What was the question they had asked on osteogenesis imperfecta? Like diagnosis, similar history. Now it is telling it was similar history. One more. There was history. There was no blue sclera. Okay, no blue sclera. Blue sclera was actually not given. Okay, anything else do you recall, beta? ओके, याद नहीं आ रहा, कोई बात नहीं बेटा. फ्रीक्वेंट फ्रैक्चर्स, पेन किलर, नो कास्ट. फ्रीक्वेंट फ्रैक्चर्स. ओके, फ्रीक्वेंट फ्रैक्चर्स, पेन किलर, नो कास्ट. ओके, दिस sort of history was given. Okay, history looks like collagen 1. Okay, collagen 1A1, but the answer was actually going for vitamin C. Okay, this was an okay. This is very, very nice information that we are getting over here, my dear friends, that this has been also a question on the vitamin C. Yes, vitamin C also collagen will be defective over here, and long standing cases they can also report this. Yes. Hemorrhage history. Okay, in this patient there was also history of hemorrhage. There was also history of hemorrhage. Thank you so much, beta. Anything else do you remember, beta? Um, okay, in this one, upper segment, lower segment was equal, and in option they mentioned osteogenesis imperfecta. Okay, vitamin option C. Collagen 1A1 was there in the option. Okay, thank you so much. And yes, so in this question we have to go for the proper recall, then only we will be able to remember this. But anyhow, we will do the brainstorming for this question one more time. But yes, this question was asked in a different one. Okay, hand foot mouth disease, so all of you know it is will going for the pediatrics question. That we will discuss separately, that your pediatric teacher will try to focus on this. Okay, so we will do the brainstorming for this question, beta. Osteogenesis imperfecta, those we have. So in the MCQs that you are telling, probably they would have shown you this particular image for that other question previously. This was the image based question that came for ricket wala question, right? This is the bowing of legs. Try to remember about this, beta. Bowing of legs wala ricket wala question, try to remember, right? Now moving to the next question over here. Yes, this question many of you had given me, that yes, they had asked about this hand foot mouth disease. Pediatric teacher HFMD will be going for pediatric question, beta. Osteosarcoma question was asked, it will go for orthopedics question, beta. Now acetyl CoA, basically yes, acetyl CoA in the prolonged starvation. Acetyl CoA in the prolonged starvation mostly will be used for. Yes, my dear friend, this question was asked, and I believe all of you would have got this one also correct. Yes, the answer is beta B, ketogenesis. Yes, ketogenesis. Cholesterol synthesis. No, cholesterol synthesis, beta G, it will be mainly seen in case of well-fed state. Non-essential fatty acid synthesis, well-fed state. Krebs cycle can be seen in well-fed state plus starvation as well. But once they ask about prolonged starvation, as the word they had used was prolonged starvation, that's why the answer will basically go for ketogenesis. Yes. Please remember, important point that we have to remember over here. ओके, यस, ईडीएस के ऊपर क्वेश्चंस था, बाप रे. You are telling that there was also a question on the Ehlers-Danlos syndrome. Okay, do you guys recall what was the question that they have asked on EDS? EDS के ऊपर क्या क्वेश्चन था बेटा? EDS, Ehlers-Danlos syndrome. It was lipogenesis in the option that they had mentioned. Okay, non-essential fatty acid synthesis option was asked like this, lipogenesis. Thank you so much beta for the right recall. Yes, lipogenesis, ketogenesis, like that they had asked the option. Okay, so ketogenesis will be the answer. Okay, thank you so much. But do you guys recall the question that they had asked on EDS beta? EDS के बारे में आप बोल रहे हो कुछ क्वेश्चन आया था. Is there or was there any question on EDS? Do you guys recall the question on the EDS beta? EDS में क्या पूछा था थोड़ा बहुत? It does it ring a bell? So we can count one more question over here. Ehlers-Danlos syndrome. शिवम बेटा जी, आपको याद आ रहा है क्या? कॉन्फ्यूज किया था एडीएस। ओके, एडीएस के ऊपर कोई क्वेश्चन वगैरह वैसे नहीं था। ओके, थैंक यू सो मच। आगे बढ़ते हैं। वी हैड आल्सो डिस्कस्ड अबाउट दिस क्वेश्चन दैट इन दिस केस वी हैड डिस्कस्ड अबाउट acetyl CoA has got four fates: NIFA, cholesterol, ketone body, and Krebs cycle. And Krebs ketone bodies mainly will be seen in case of fasting and starvation. The other two is mainly seen in case of synthesis. This is also picked up from the workbook that we have discussed earlier in our notes. Moving to the next question over here, question number 13. Yes, straightforward question, anticipated question. I believe all of you would got this one correct. Okay, this question. Okay, what is this आंसर बेटा जी? यस, हिस्टिडीन डेफिनेटली वुड हैव गॉट दिस वन ऑल करेक्ट बेटा। ये क्वेश्चन तो नींद में भी आप लोग गलत नहीं करोगे, डेफिनेटली माय डियर फ्रेंड्स, यू वुड हैव गॉट दिस वन करेक्ट, राइट। इसमें कोई दिक्कत वगैरह डेफिनेटली नहीं हुआ होगा। हिस्टिडीन। Yes, that Yash, we have also discussed about the question earlier, but probably you have joined little late. We have discussed about that decreased question eating since less in the week. Okay, so histidine was an expected question area. I did mark so many star mark over histidine, and I told you better that you please do not miss histidine. Other things, there was an old question, but histidine was a latest question, and it is the blood buffer over here, right? Hope all of you have got this one correct. There was a question like this in the diabetic cataract, I believe. Yes, yes, this question beta, which of the following compound is getting deposited in the lens in diabetic cataract? Anurag, upper and lower segment disproportionate achondroplasia. Achondroplasia, okay, that also we will try to remember beta. Yes, the answer of this question beta is sorbitol. Sorbitol. I'm just going back one more time that there was some question on the achondroplasia, so I will just try to collect more information from you guys. Achondroplasia. Achondroplasia. We will try to search. The disproportionate limbs was actually mentioned. Disproportionate, that we have also discussed. Dip, disproportionate limbs, my dear friends, that we have also discussed earlier in our class, that the proximal limbs will be actually shorter than the distal limbs, if they have asked also like this. Okay, I will note it. Now coming to sorbitol beta, sorbitol has been also picked up from this our note that we have discussed. Aldose reductase will convert, that is the culprit enzyme, and this is mainly causing snowflake cataract, snowstorm or starry sky appearance, that we have also picked up over here. इसको एक बार देख लीजिएगा, right? This is another question which was asked like this in your exam beta. This is another question which was probably picked up like this. In this question beta ji, try to recall, there was some options like this. Yes, okay, great, all of you are thinking in the right line beta. All of you are thinking G6PD analysis. Okay, G6PD, yes, G6PD पे ऊपर एक क्वेश्चन था. Antimalarial drugs, family history of hemolytic anemia. Okay, traveler history was given. Traveler, okay, this is just a direct question and expected question area from our workbook. Vivax का history था. Okay, try to understand. We have discussed that this is an EQ section of our note beta, and I told you that we have a very important compound that we should never ever forget, reduced glutathione over here. This is the guy that we should recall. And we had also discussed in this expected question area that antimalarial drugs, please try to understand, this should be also contraindicated, right? But okay, thank you. G6PD deficiency will be the answer. Is elaboration. Yes, there was also a question of biochem from this beta. There was also a question of biochem from this. Reduced glutathione, yes, males. Okay, males in family. Okay, they had also talked about the males. Okay, I will just mention males over here. मेल्स का हिस्ट्री दिया हुआ, ओके ओके ग्रेट ग्रेट, ओके दिस क्वेश्चन वाज देयर बेटा. Answer was G6PD sickle cell. Okay, G6PD deficiency. They had also mentioned about sickle cell anemia. Sickle cell anemia was also okay, 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 okay. Sickle cell G6PD. They had also mentioned about reduced glutathione. Okay, they had also mentioned about reduced glutathione. Right, important. Hmm. Okay, great. Okay, no problem, no problem. What was the answer of this question? This question is repression nahi tha. Okay, repression was not there in the option beta. Some other option would have come, but I believe all of you would have got this one correct. In this question, what is the answer? That phosphorylation and the dephosphorylation will basically go for type of covalent modification beta. Covalent modification. Please try to understand this. Covalent modification. Right? Hope you have all got this one correct. Covalent modification, yes. Allosteric, okay, 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 great. Spondyloepiphyseal dysplasia, okay, Ritupriya, thank you in that question beta. Spondyloepiphyseal, okay, okay. In this question beta, the answer, if it is asked as phosphodephosphorylation beta, if they have asked phosphodephosphorylation, please remember this is actually going for covalent modification. Covalent modification. Covalent modification, yes, this is an important point. Try to remember this beta. इसको एक बार देख लेना बेटा. Covalent modification, this also has been picked up from our note that we have just discussed. Covalent modification is one of the example that we have studied. Phosphodephosphorylation. Phosphodephosphorylation, right? This is a question that has been picked up from over here beta. Coming to this question, try to recall. It might be overlapping with physiology as well. It might be overlapping with physiology as well beta. Which of the following will cause a right shift in the oxygen hemoglobin dissociation curve? Basically they have asked question from the mnemonic of cadet. Cadet वाला mnemonic में को ऊपर कुछ था. Try to recall beta this question. Yes, this was there, my dear friends, picked up from the note. It is acidosis. Acidosis, yes, acidosis. Chocolate question, cadet. Yes, acidosis is the answer. We have also discussed this multiple time. Mnemonic was he is cadet. That oxygen hemoglobin dissociation curve shifts to right. It is a type of allosteric inhibition. And in this one, we have also discussed KSA acidosis. This was also discussed in our class. Hope you recall this. My dear friends, I have not been able to collect the proper info on this sort of few questions. Try to remember better. Was there any question on the phospholipid metabolism? Was there any question on the phospholipid metabolism over here? I have got some incomplete data regarding this sort of things. Please help me. Reduced 2,3 BPG was there in the option. Okay, I will write it better. Reduced 2,3 BPG. Reduced 2,3 BPG was there in the option. Hypothermia, they had mentioned about hypothermia. Hypothermia, hypothermia decreased to 3 BPG. Okay, 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 okay. Hypocapnia, okay, hypocapnia, that means your uh, CO2 level will be going down. Hypercapnia is high CO2, yes. How 2,3 BPG acidosis is the correct option. Okay, okay, okay. Now coming to this, please help me in this better. Okay, negative, okay, negative serum iron question was there, but what was the question beta? What was the question? Phospholipid wala membrane, okay. So this question actually will go for that phosphatidylserine. Are you talking about that question where they had talked about our I mean this apoptosis story, that flipping on the outward surface? Is it a question on the phosphatidylserine beta? Rigidity of cell was negative and questions are okay. Don't recall it. Okay, rigidity of cell membrane question. Rigidity of cell membrane. Okay, that will be a question of physiology beta. Rigidity, I will share this thing with the physiology teacher beta. Rigidity of you said cell membrane. Rigidity of the cell membrane. Okay, this will be a question of physiology beta. This question will be picked up by your physiology teacher. Please do let him know regarding this. What about this question beta? Negative imbalance. Which component is affected in negative iron state? Negative iron state. TIBC, transferrin saturation. This is not iron saturation beta. Yes, I was expecting this, that they might have given transferrin saturation. So this will be an overlapping topic between hematology beta. Negative iron state, what is affected? Okay, I will share this question with the pathology faculty as well beta. Serum iron, TIBC, I think it will go mainly for that. Was there any question on this? Yes, negative imbalance of iron. Yes, ferritin beta. Okay, in this four option we have got ferritin. In this we have also got ferritin. So these are the four parameters they have asked. Instead of saturation, they have just asked transferrin saturation, negative iron imbalance. So what did they actually ask? Reduced transferrin. What was the exact question? See, all these are the parameters. So negative balance of the iron. Yes, my dear friends, it can be affecting all of them. The serum ferritin, serum iron, both can be also decreased over here. Reduced iron, increased TIBC. Okay, like that. Reduce iron, increased TIBC. Increased TIBC. They had also asked about this. Oh, template strand sequence. Okay, in this question, template strand sequence was mainly asked over here. That's the meaning. That means whatever we have to just make it opposite. A will be with T, C will be with G. Plus, please try to understand in case of RNA, if they have asked, then we have to modify it also with uracil. Uracil will be only found in case of RNA. So, based on that, what pattern they had asked, try to understand. Negative iron balance regulator. Yes, DNA and RNA transcription. Okay, this is just opposite. This is a very simple question. Also, I believe all of you would have got this one also correct, but all of you would have got also this one correct. Transcript ke pucha tha. And I think few of you are also talking about this question beta. I did not get the proper history of this question. I did not get the proper history of this question. Try to remember this beta. Did not get the proper history of this question beta. RNA sequence was asked basically. Okay, template sequence for RNA. Okay, thank you so much beta. Okay, it is easy question. Yes. Yes, RNA. Okay, I believe this question was also there, beta. I mean, people were also talking about this. Electric shock history. Yes. Burning. Yes, electric burns, my dear friends. There can be also hemoglobinuria in this patient. Yes. So, what was the question they had asked? Okay. 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 Electric burn, and what's the reason for such a urine? What is the reason? What is the reason for such urine? Okay. Okay. Electric man. Okay. Electric man history. Okay. Those who go for repair work. Electric man history. Okay, got to understand better. This was the history that they had cooked up. Okay. 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 यूरिन में क्या मिलेगा? Okay, what will you find in urine? What is the not reason beta, what is the finding? What is the substance? What is the substance? Or like this, found in urine. Okay, found in urine. Okay, got it. found in the urine. Okay, what does this urine indicate? Okay, okay, what is the substance it is being? What is the fourth option, beta? Do you recall all the four options, beta? Hemodynamically stable. Okay, hemodynamically stable. uh, Creatine kinase. Okay, okay. Yes, electric shock, maybe there will be rhabdomyolysis, but definitely yes. Fine. Reason for this, oh my god. Okay, confusing. Okay, कोई बात नहीं बेटा, I will do the brainstorming for this. Don't worry, don't worry, don't worry. Many histories you guys are telling. I mean, many feedback is coming. चलो कोई बात नहीं बेटा. Reason actually based on the option, beta, based on the option. Reason for this, okay. Increased RBC in the urine. They had shown the image and they asked what is the reason for this. Okay, increased. This is looking like the cola color urine. It might be due to rhabdomyolysis. So reason for color of urine. Okay, reason for color of urine. Take home point that we have to remember. And I believe all of you also would have got this one correct, beta. Rhabdomyolysis. Uh, okay, 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 okay. Rhabdomyolysis, beta. Okay. ओके, रैप्डोमायोलाइसिस अगर है बेटा जी, रैप्डोमायोलाइसिस है तो दो इट विल गो फॉर द क्रिएटिन काइनेस बेटा. देन वी कैन आल्सो गो फॉर दिस. I mean, basically the rhabdomyolysis will take place, muscle lysis. In this one, we have heard the type 3, CK3. My dear friends, in our discussion, we have discussed about CK3, which is also called as CKMM. That is also in case of any case of rhabdomyolysis will be there. So try to understand this beta. इसको हम लोग ये mark कर सकते हैं, right? Okay. Yeah, rhabdomyolysis. No, no. We are telling that rhabdomyolysis will be seen in these patients of the electric electrocution, and because there will be skeletal muscle damage that will be caused as a, I mean this. Okay, so definitely we can also choose the answer as this creatine kinase. Thank you so much for coming online just one day after the exam and helping us to correct some information regarding this. Thank you so much for giving me patient hearing, but I will try to do more brainstorming, and I believe all of you would have definitely got the required number of MCQs correct to just pass in the exam. But okay, don't worry, don't panic now. Sit back, relax, and also enjoy the other recall sessions by the other faculties at MIST, and please do hope for the great result. My best wishes are always with you guys, everyone, and sincerely hoping that each and every one of you will be able to pass. A big thumbs up from the entire team of MIST. You guys will be definitely able to pass. Please try to understand. Yes, okay, thank you so much for giving this. What is the first line? Okay, there is a question that you are adding over here, beta. What is the first line of defense for? Okay, I will just try to take a screenshot of this and try to remember, beta. Okay, thank you. First, before hypoglycemia, increase glucagon, decrease insulin. Hypoglycemia में first we have to remember, beta, that first line of defense. Yes, the full options will be required over here. Hypoglycemia, increase, decrease insulin. Hypoglycemia, it will be glucagon, beta. Glucagon, my dear friends, because it will try to activate our glycogenolysis pathway. Glucagon activates our glycogenolysis pathway, and it will try to maintain the blood sugar level for up to 18-hour mark that we have discussed. And in case of glycogenolysis pathway, my dear friends, basically we are having the role by glucagon through the cyclic AMP. Glucagon will be the first messenger, cyclic AMP will be the second messenger that will try to activate glycogen phosphorylase enzyme in our liver, that will try to break down the stored glycogen to give you glucose that will try to maintain the blood sugar level. So if they have asked that one more question over there, then it will go for glucagon. Yes, glucagon. Cortisol भी था. Yes, cortisol. Yes. Okay. Epinephrine. Okay. Release of cortisol, decrease insulin, increase glucagon. Beta. First line अगर पूछा, if they have asked the word as like first line of defense, then it will go for increased glucagon. Beta. ग्लूकागॉन स्टारवेशन में ज्यादातर ये करेगा, ग्लाइकोजेनोलाइसिस। यस, थैंक यू सो मच फॉर वन मोर क्वेश्चन फ्रॉम बायोकेमिस्ट्री बेटा। वी विल ऑल्सो keep on contacting each other, and we will try to get the best possible, I mean, options that we can also remember, so that it will be helpful for the upcoming batch of students as well. Austrian imperfect question, there was no history of fracture. Okay, ठीक है, कोई बात नहीं, that is a confusing question, because I believe it might be a question of also orthopedics, because you are also telling about those achondroplasia features and all. कोई बात नहीं, आराम से sit back, relax and try to recall. All of you have my number. In case anything just keeps up in your mind, please do feel free to contact me. Thank you so much beta, thank you so much, and let's hope from the entire team of mist all of you guys can pass in the exam beta. Thank you so much, thank you so much, thank you so much for the right recalls. Thank you for helping me with the options, and God bless you my dear friends. Yes, just wait, sit back, relax, and the great results are coming on the way my dear friends. For each and every one of you, you will pass. Thank you so much for joining this session. Thank you so much.